So your patient comes in and asks, can you help me because I have a jammed finger? Yes, you can. As long as they've been to the doctor, there's no break, they didn't tear a ligament, it's just simply been compressed. We're going to discuss how I take care of individuals who have jammed fingers because I get basketball players in here all the time that have this problem. So let's go down to the table and I'll show you what I do.
So what we've done is we're identifying which joint it is. Obviously, I'm holding this finger, so we're going to look at as a distal interphalangeal joint. This is where the jamming has taken place. There'll usually be like a little mallet formation to it because the tendons are pulling, the joint in because it's trying to protect itself. It's a defense mechanism. So what we want to do is we want to make sure that when we work this, that we're actually grabbing, and I use my thumb and my index finger, we want to make sure that we're grabbing just on the distal aspect of that joint itself. We don't want to grab the full joint, and we don't want to grab on the proximal aspect of that joint. We want to be on the distal aspect of the distal interphalangeal joint itself. So if I say distal twice, it can be confusing, so let's just look at it this way. As far away from that joint as you can, and you can still hold the fingertip. Now, we'll see bruising in there, we'll see where the damage is, but what I like to do is let the arm hang off the table. So in this case, the patient's arm is hanging off the table, and I'm allowing their body weight to do the work. So I'm just going to move the finger medial to lateral. I'm just going to shake the arm. Now this hurts at first. They'll say, ow, ow, this is hurting. And it does. But you just do this gentle rocking, and after a minute to 2, maybe even 3 minutes in, all of a sudden they're like, this feels amazing. This feels so good. Because you're shutting off that nervous system. You're allowing those tendons and ligaments and muscles to relax. And if you have lotion on your hand, this isn't going to work. You better make sure you don't have any lotion on your hand. You got to make sure this is dry, so make sure you towel it. Make sure there's no oil whatsoever, so you can get a good grip, because it's hard to grip the little tip of the finger there. Now, if the jamming is up in here, up into the metacarpal interphalangeal joint, the metacarpal phalangeal joint, we're going to grab up there. We're going to do the same thing. We're just going to shake from this point. So we're going to open it up. It's just a gentle rocking back and forth. And again, their arm is doing, I'm not grabbing here and pinning the wrist and pulling an extension. I'm not doing that. I'm allowing the body weight to do the work and allowing it to shake. And and you can actually, if you want to, you can do a little bit of circumduction. That feels really good too, on wherever the joint itself is jammed. If it's the proximal interphalangeal joint, you can do that. But again, I'm on the distal aspect. I'm not grabbing deep in there, because then you're on the joint itself, and that's not going to do any good. You have to be as distal as possible and still maintain pressure. And then I let go and just allow that rocking motion. And you can teach them how to do this at home. So they can do this as home therapy, all the way down just like this. Okay? All right.
Well, I hope you enjoyed that tip on how to take care of somebody who has a jammed finger. Again, we're licensed massage therapists. We're not doctors. Make sure they've had their doctor's approval to do this. But it works for me. I've helped a lot of people with this issue, and I know you're going to help your patients also. And if they do feel a lot of discomfort after you're done, you can tell them to put a little bit of ice on it, a little bit of cryotherapy, and that'll help them speed up the healing of this. But it shouldn't be any big deal whatsoever. So just remember this: if there is no discomfort on the table, in other words, they're just humming and singing along as we do this massage, well, then it's nothing more than a foo-foo massage.